Kitchen Cures, from your fridge to your pantry, finding the foods for you. In honor of Breast Cancer Awareness Month, we wanted to take an episode to spend some time talking about the connection between food and your hormones, and is there any relationship between food and prevention of breast cancer? Joining me today is my dear patient, Nicole Jacobs, with whom I've had the opportunity to share a fascinating journey as she has wandered through the diagnosis of breast cancer, now through treatment, and now she looks forward to recovery. Thank you for joining me.
Thank you for having me.
So many women go through this journey, one that I've just described for you, where they suddenly get this diagnosis of breast cancer. Talk to us a little bit about what that moment is like, what runs through your head, and what do you do next?
Well, I remember when I found out, I was ordering my salad at Wendy's, and it felt like a lightning bolt hit me, you know. And I remember feeling, it's strange because I surprised myself, feeling a strange sense of, okay, you know, that even if this kills me, I'm okay with that. But then what really was bad was the feeling that, you know, my young children who were 3 and 5 at the time would be left without their mother. And I'm very hands-on mom, very involved, and I couldn't bear that. You know what I mean? So that was probably my biggest motivation, kept me going through the whole thing.
And so many of you share that same sentiment with me. Your mothers, you have young children, or you have older grown children or grandchildren. But the story of breast cancer and that initial feeling, did you ever think you would get cancer? Did you ever think you would have a diagnosis of breast cancer?
No. That kind of thing happens to other people.
And you know? That's exactly what I hear all the time.
Yeah.
I mean, what I hear frequently in the exam room is that I'm healthy. I don't get this. I do everything. I follow everything I'm supposed to do. So you get the diagnosis and you begin your journey and you went through treatment. What were those months like of seeking doctors to help with treatment, trying to find the right treatment for you? Kind of walk us through that process and sort of what motivated you to stay strong, stay healthy, and move forward.
Well, that was my biggest first step. Is finding out as much as I could, all my research, and which I do a lot of, and figuring out the best doctor for me for oncology. And I wanted to get a very specialized reconstruction that I didn't feel comfortable about getting here in Atlanta at that time. That was a couple of years ago.
Mm-hmm.
So I was looking nationally, and I wound up going to San Antonio, Texas for the reconstruction, which you could probably get here better now than you could a couple of years ago. So it was really just digging information and making important decisions and fighting for, I'm not going to just do what you tell me to do and settle. I'm going to do this the way I want to do it.
And that's one of the things that has fascinated me about Nicole, is that she really did dig in. She really vetted every doctor in the country to find the best for you, and the motivation again being, I have to be here, I have to be here.
I have to be here. Right.
Well, that was a few years ago, as you said, and now you are healthy, and we are moving forward. As you look backwards and forwards, honestly, what is the connection between how you ate, how you're eating now? What's the connection between food and cancer for you?
Okay, well, I remember when I first became your patient several years ago, you managed to uncover the fact that I had excessive DHEA, which is the male androgen hormone, and blood sugar issues. And I remember you telling me back then that those two things are tied together. Well, it turns out that my particular cancer is not only driven by estrogen, but it's strongly driven by androgen. So I feel that perhaps if I had known about all this years ago, if I had eaten the low glycemic index, anti-inflammatory diet that you talk about, maybe it would have helped prevent this.
And it's always hard to have a crystal ball and know exactly how everything's playing out, but what I would keep in mind is that there is a connection. We know it from Nicole's case, we know it from other patients I've seen, we know it from research, that there's absolutely a connection between your blood sugar levels, your insulin regulation, inflammation, and cancer. And those things almost fall like a domino effect as you go through life, and if you don't tackle them, then again, you're sort of setting the stage for something down the road. We can't ever look back and say, yes, that's what did it. I would never venture to say that. But as you think forward now, talk to us about how you eat. What are the key things you bring into your diet? What are the key food components for you that you're doing now to make sure insulin's managed, to make sure, we're doing everything we can to keep your hormones balanced. I know what we're doing from like a medication supplement and all that, I know what we're doing there. But tell our viewers what you're doing about food.
Well, I did your 21-day belly fix diet, and I feel that it changed my life because
I'm glad to hear that.
yeah, I'm not a paid person, really. This is all true. Because, I feel that it totally cut out those cravings and the blood sugar imbalances that I've always had. I feel like it kind of revved up my metabolism a little too. So what I'm focusing is, I still do the apple cider vinegar every day.
Fantastic.
And keep my starchy stuff way down, and as low glycemic as I can. And I try to substitute that space on my plate with more vegetation.
More greens, and fruits and vegetables.
Yeah, and I definitely avoid sugar like the plague. It's a very occasional treat.
No sweets?
Very occasional.
No
Maybe,
chocolate?
no.
Are you sure?
I'm not kidding. I am not kidding. Like maybe once a month I might have a little something. But, I used to have a lot more than that because I was always on the up and down roller coaster of blood sugar, and I had crazy cravings for it,
I remember. One of the things Nicole is not telling you is that through her connection or being able to connect food and her health, she's also lost a tremendous amount of weight.
Oh.
Her numbers look amazing when when we start to look at that. So she really is on a path to healing and a path to really being her best self, which is super exciting for me. Is there anything else you would want to share with our viewers about cancer, breast cancer, food for cancer, anything you would like to leave so many of the people that watch this that are people like you, what is the one thing you'd like them to take away from this?
I felt that through the course of my treatment, no matter how bad things were, I felt that I was being perhaps watched and guided and looked over and along the way, and assured that everything was going to be okay. So I feel that if this happens to you, it's important to think that this is actually a spiritual journey, possibly, that was given to you for a reason, and to know that you're not alone in it.
I love that. So I'm going to leave it there without any more comments because I think that's so powerful. Thanks for watching. Please join us next time for more episodes of Kitchen Cure.